a touch, a miracle. The healing of a man born blind by Jesus, using mud and saliva. Was it pure faith, or is there something deeper? Something that modern science can reveal about this enigmatic healing? Get ready to unravel one of the greatest biblical mysteries in a new light. From the dawn of humanity, blindness has been a condition that sparked both fascination and fear, intertwined with religious beliefs and superstitions. In ancient societies, the absence of sight was often associated with divine punishment, demonic possession, or, at best, an irremediable fate. The medicine of the time, rudimentary in its understanding of ocular anatomy and physiology, could offer little beyond palliatives, superstitious rituals, or, in rarer cases, nascent attempts at cataract removal. Opaque eyes, dilated pupils, or the absence of light reflex were clear signs of a life in darkness. In the biblical context, the man born blind is presented not only as an individual physically afflicted, but also as someone on the fringes of society, dependent on others' charity and often stigmatized. His condition was seen as permanent, with no hope of reversal, which made any account of healing even more extraordinary and challenging to the expectations of the era. The disciples' very question to Jesus, "Who sinned, this man or his parents, that he was born blind?" reflects the prevailing mentality, which sought a moral or punitive cause for disability. This view not only marginalized the individual, but also prevented any deeper investigation into the actual causes of blindness, whether genetic, congenital, or acquired. Understanding this perception is crucial to gauging the impact of the event in question. The miracle, therefore, was not merely about restoring sight. It was an act of breaking social and religious paradigms, defying the fatalism imposed by the condition, and subverting the expectations of a people who saw blindness as an insurmountable barrier to full participation in life. The healing was not just physical. It was a social and spiritual reintegration, a testament to a power that transcends human limitations and simplistic interpretations of illness. Furthermore, blindness in antiquity directly impacted one's ability to subsist, making the individual a burden on family and community, which intensified the stigma and marginalization. The healing of such a condition was thus seen as an act of profound compassion and a sign of divine power. The scene is intriguing. Jesus spits on the ground, makes mud with his saliva, and applies it to the blind man's eyes. At first glance, it appears to be a purely symbolic act, laden with spiritual and theological meaning. The mud, referring to the creation of man from the dust of the earth, could symbolize a recreation, a new beginning, a restoration to the original form of divine creation. Saliva, in turn, was considered in many ancient cultures as a fluid with healing, purifying, or magical properties, present in healing and purification rituals. In some traditions, the saliva of people considered holy or with spiritual power was valued for its supposed medicinal properties. However, modern medicine invites us to go beyond symbolism and explore a possible biochemical basis. Human saliva is a complex fluid containing a myriad of bioactive components. Among these, enzymes such as lysozymes stand out, possessing antibacterial properties by breaking down bacterial cell walls, and lactoferrin, with antimicrobial, anti-inflammatory, and immunomodulatory activity. Furthermore, saliva contains growth factors, such as epidermal growth factor and nerve growth factor, and proteins like histidins, which aid in wound healing and tissue repair, as well as preventing infections. While it is unlikely that saliva alone could heal a structural congenital blindness, its application in a compromised ocular environment could theoretically have helped combat secondary infections, reduce inflammation, or promote a more conducive environment for regeneration. If any viable ocular tissue existed, or if the blindness was infectious, inflammatory, or caused by some reversible condition. Mud, in turn, is composed of minerals and clays which, depending on their composition, can have absorbent, antimicrobial, and even detoxifying properties. Some clays are used in traditional medicine and modern therapies for their ability to absorb toxins, reduce inflammation, and even promote wound healing on the skin. The application of moist mud could have a cooling and soothing effect on an inflamed eye. The combination of both, even in the context of faith, raises the question of whether there was a biological interaction, however minuscule or complementary, that optimized the power of the miracle. Were these elements then mere vehicles of divine healing? Or did they play an active, albeit secondary and imperceptible at the time, role in the process of restoring ocular health? The answer lies at the intersection of the blind man's unwavering faith and divine power, where the intangible manifests in the tangible, and where science can offer additional perspectives but not exhaust the mystery. The possibility of a biological action, even if secondary, does not diminish the miraculous nature of the event but contextualizes it within a broader understanding. To understand the depth of the blind man's healing, it is fundamental to comprehend the complexity of human vision and the various causes that can lead to blindness. Our eyes are true marvels of biological engineering, functioning like an intricate camera that captures light, focuses it through the lens, and transforms it into electrical impulses in the retina. These impulses are then transmitted by the optic nerve to the brain, where they are interpreted as the images we see. This process involves the perfect coordination of multiple components: the cornea, the iris, the lens, the retina, the optic nerve, and the various visual areas of the brain. Any failure or damage in one of these parts can result in visual impairment or blindness. Blindness can be congenital, meaning present from birth or acquired throughout life. Congenital causes are varied and complex, including severe ocular malformations, structural anomalies in eye development, such as anophthalmia, microphthalmia, or coloboma, congenital cataract, opacification of the lens, preventing light from reaching the retina. In antiquity, this would have been an irreversible cause of blindness, but today, it can be surgically corrected, restoring vision if the optic nerve is intact. Congenital glaucoma, increased intraocular pressure that damages the optic nerve, usually due to abnormal development of the eye's drainage system. Retinopathy of prematurity, abnormal and disorganized growth of blood vessels in the retina of premature babies, which can lead to retinal detachment and blindness. Ocular albinism, lack of pigmentation in the iris, retina, and choroid, affecting visual acuity and causing photosensitivity. Leber congenital amaurosis, a rare degenerative genetic disease affecting the retina, causing blindness or severe vision loss from birth or early childhood. Optic nerve atrophy, damage or degeneration of the optic nerve that prevents the transmission of visual signals to the brain, which can be caused by genetic, metabolic, or neurological conditions. In many of these congenital cases, especially in antiquity, and even with current technology without complex and specialized surgical interventions, blindness would have been considered irreversible. However, it is important to note that there are forms of congenital blindness that, although rare, are reversible or treatable. Congenital cataract, for example, if it is the cause of blindness and the optic nerve is intact, can be corrected through surgery, restoring vision. Other disorders that do not involve irreversible structural damage to the eye or optic nerve, such as some forms of functional or psychogenic blindness, although less likely in a born blind case, could also, in theory, have a spontaneous recovery or be induced by external stimuli. Jesus' miracle in healing a man born blind leads us to ask, what was the specific cause of this man's blindness? The Bible does not specify the ophthalmological condition, which opens the door to various interpretations. The answer to this question is crucial for a scientific analysis of the event. as different causes would have different prognoses and possibilities of healing, even if miraculous. If the blindness was due to a congenital cataract, the instantaneous healing would be an extraordinary event. If it were a complete optic nerve atrophy or a severe malformation that made light capture and transmission impossible, the magnitude of the miracle would be even greater, completely defying known biological laws and requiring a recreation of tissues. One of the most fascinating and dynamic aspects of neuroscience is brain plasticity, the remarkable ability of the brain to reorganize itself, form new synaptic connections, and even create new neural networks in response to experiences, learning, injuries, or, as in this case, the restoration of a sense. This plasticity is particularly evident in cases of vision restoration in individuals who have been blind for long periods, especially since birth, a phenomenon known as late sight. Studies with patients who have had their vision restored after years of blindness, whether through congenital cataract surgery or other ophthalmological interventions, reveal a complex and challenging process of visual and perceptual adaptation. The brain of someone born blind, deprived of visual stimuli from an early age, does not develop the neural pathways and cortical areas specialized in interpreting visual information in the same way as a brain that is seen since birth. The visual areas of the cortex may even be taken over by other senses, such as touch or hearing, to process information more efficiently. Initially, after vision is restored, the world can appear as a jumble of lights, colors, and shadows, without clear form, depth, or meaning. The brain needs to learn to see, to interpret the barrage of visual data, identifying objects, recognizing faces, perceiving depth, and navigating space require a long process of learning and rehabilitation, where the brain gradually builds a new visual map of the world, training itself to make sense of the complexity of images. This process is often slow and may not result in normal vision, especially if the blindness was long-standing. Jesus' healing of the man born blind may have triggered a rare or extraordinary neurobiological event, acting as a catalyst for accelerated and profound brain plasticity. Could Jesus' act have activated or reconnected dormant neural pathways, or stimulated a neural reorganization that would otherwise take years, if it happened at all, or never occur? The speed of the healing described in the Bible suggests a degree of brain reorganization that defies current neuroscientific understanding. While there is no direct scientific evidence to explain such instantaneousness, modern neuroscience recognizes the profound power of the mind, faith, and expectation in modulating perception, brain function, and even recovery from neurological conditions. To see is not merely a biological act of the eyes. It is a complex and continuous interpretation by the brain, shaped by experiences and learning. It is this intricate interconnection between the organ of sight and the brain, as processing center, that allows us to ponder the deep and multifaceted nature of the healing, where the miracle may have manifested not only in the physical restoration of the eye, but in the surprising and almost instantaneous reactivation and reorganization of brain neural networks, a testament to a power that transcends the known barriers of plasticity. The history of medicine and psychology is filled with fascinating accounts where the patient's belief, rather than the substance or treatment itself, plays a crucial role in recovery from illness. This phenomenon is widely studied and known as the placebo effect. When a patient firmly believes that a treatment will heal them, whether it is an inert drug, a ritual, or a touch, their body can respond in surprising ways, activating internal physiological mechanisms. This effect is not merely psychological. It has proven neurobiological basis, involving the release of neurotransmitters like endorphins, the modulation of the immune system, the alteration of pain perception, and even changes in brain activity in regions related to pain, emotion, and reward. Faith, in the context of Jesus' miracle, can be seen as an extremely powerful and amplified form of divine placebo. The blind man's unwavering belief in Jesus' power to heal, combined with the expectation generated by the physical act of applying mud and saliva, which, as we have seen, could have some secondary biological action, but the primary power would lie in the conviction, may have triggered a series of physiological and neurochemical mechanisms in the blind man's body that culminated in the restoration of his sight. This perspective does not diminish the miracle, but offers a lens that seeks to reconcile the spiritual dimension with a scientific understanding of the human body's mechanisms. In cases of functional or psychogenic blindness, where there is no irreversible structural damage to the eye, the placebo effect can be particularly potent, restoring vision by reactivating neural pathways that were suppressed or unused. Even in organic conditions with some degree of reversibility, such as severe inflammation or a condition that could have been exacerbated by stress and hopelessness, the modulation of pain, stress, and anxiety, promoted by faith and hope, can optimize the body's natural healing capacity and its response to interventions. The healing of the man born blind, from this perspective, invites us to reflect on the profound and still poorly understood connection between mind, body, and spirit, and how belief, whether religious or a medical expectation of cure, can dramatically influence health and well-being outcomes. The miracle, therefore, may have been a divine intervention that operated through mechanisms that modern science is only beginning to unravel, where faith acts as a catalyst for the manifestation of a healing that transcends the ordinary. The element of transformative faith is central, as it is not just a remedy, but a conviction that moves mountains, or, in this case, brings light to one who had never seen it. Despite all the monumental advancements in medicine, neuroscience, and biotechnology, there are phenomena in human existence and the universe that continue to defy our understanding. The healing of the man born blind by Jesus, even when analyzed under the most rigorous lens of science and rationality, still holds a profound and intriguing mystery. If the blindness was indeed congenital and irreversible by the means and knowledge of the time, or even by most current means for certain conditions like total optic nerve atrophy or congenital absence of the retina, the complete and instantaneous restoration of sight transcends purely biological explanations and the models of causality we have. Science seeks patterns, laws, and repetition to formulate theories. A singular event of such magnitude, without documented precedents under identical conditions, forces us to confront the limits of what we can explain. It is at this point that science, with its relentless search for answers and its empirical methodology based on observation, experimentation, and verifiability, encounters the limits of its capacity to explain the world. The miracle, by its very definition and nature, is an event that seems to defy the natural laws we know, that goes beyond what is considered possible within our current models of reality and understanding. Was the healing of the blind man an extremely rare spontaneous event, a manifestation of brain plasticity at a level not yet understood and instantaneous, or proof of a divine intervention that operates outside the laws that science has been able to catalog so far? The instantaneousness of the healing, without a long process of visual rehabilitation, as observed in cases of late sight in modern medicine, is one of the most challenging aspects for a purely scientific explanation. The beauty of this enigma lies precisely in its capacity to prompt us to question, to explore, and to recognize that not everything can be cataloged, measured, or explained by formulas and equations that our finite minds have devised. There are dimensions of reality that still elude us, and the inexplicable may simply be the yet-to-be-explained, or that which, by its nature, transcends humanity's total comprehension. This does not mean that science should stop investigating, but rather that it must operate with an intrinsic humility, recognizing that the totality of reality may go beyond what its current instruments and methods can capture. What the miracle of the man born blind ultimately reveals to us is the vast and almost boundless complexity of human existence, the profound interaction between body, mind, and spirit, and the humility to acknowledge that there are forces and phenomena that still transcend our limited scientific understanding and may point to a higher dimension of existence. The healing of the man born blind, an event that spans millennia. Was it a miracle, science, or a convergence of both? Faith, mud, saliva, and the complexity of the human eye intertwine in a mystery that invites us to look beyond the visible. What else does the universe hold, waiting to be unveiled?